Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Hi, everyone. Welcome to another episode of the Egg Whisperer Show. I am so excited to have a special guest, Dr. Kate OLeary, on with us today. Hi, Dr. OLeary.
Hi.
So we're here talking about fertility treatment options for military families. And there's a reason why she's our special guest. I'm going to tell you that reason here with her bio. It's amazing. She's double board certified in OBGYN and reproductive endocrinology and infertility. She completed her fellowship at Stanford University and received so many honors along the way and went to medical school at Northwestern University. She did her residency in OBGYN at the San Antonio Uniformed Services Health Education Consortium at Lackland Air Force Base, also earning a lot of awards. And then while she was a fellow, not one fellowship was enough for this doctor. She then completed another fellowship in healthcare research and policy. Dr. OLeary, thank you for being on our show. Tell us where you practice fertility medicine, and we want to learn more about you.
Yes, I'm so happy to be here. Thank you for inviting me. So I practice currently in Cincinnati, Ohio. I'm at the Institute for Reproductive Health, or IRH. Our main big office is in Cincinnati, and we have 3 other satellite offices in Louisville, Kentucky, Florence, Kentucky, and Westchester, Ohio. And all the doctors drive to all the satellites, and so you can find me at all of those locations.
And you've had a military career. Tell us about that.
Yes. So 20 years ago, when I got into med school, I investigated the Health Professions Scholarship Program. It's done by the military, all the branches, and it's a way to help pay for medical school while also serving in the military. And I thought that sounded like a good opportunity. And so I did that. I got accepted. And so that started my career in the military. So they paid for my education at Northwestern. I did my OBGYN residency and military training, really great training in San Antonio with my Army colleagues. And then I had an opportunity for further fellowship training that the military also helped me pay for, and as a return, I would serve a year for a year of my education training. So I served 7 years active duty after all of that training in Ohio.
And what advice do you have for other women physicians who, or even male physicians who want a medical military career?
Yeah, this is a great question. I really wish that someone had kind of walked me through what I should expect. The biggest thing would be to find somebody who is a military doctor who is a veteran and has served, so they can tell you how their experience was. There are a lot of important considerations that you need to remember. So first of all, you're going to go to boot camp, so that's hard. You're going to learn how to be an officer. So you are an officer first, so officer and then doctor. So it's just important to realize you have dual responsibilities. So you're an officer, you're a leader. Another very important consideration is that if you know that you want to be a doctor that's super subspecialized, like interventional radiology or something like that, you need to remember that the military will serve their needs first. They need to fill their military spots like OBGYN, general surgery, general practitioners, before we do all these subspecialists. So you may not have an opportunity to do a fellowship or get that training while in the military, and you may serve as a less specialized physician and then have to do that training later. So that's really important. Something I didn't realize. I got lucky because the military needed reproductive endocrinologists. There's only a handful of us, but I got a spot, thankfully. And so that is how I got that opportunity. So talk to somebody that you know that's been through it.
Awesome. And then let's talk about some fertility stuff related to military families. I mean, you obviously have a very unique perspective because of all the work that you've done. Are military women at higher risk for suffering from infertility?
I think yes. There are a lot of unique differences in life in the military versus civilian. And one thing that we do see more of in the military is tubal factor infertility. So a lot of our female active duty soldiers and airmen, they're younger, they move around a lot, and they might be exposed and get diagnosed with more sexually transmitted infections. Mm-hmm. So we do see more STIs, and as a result, more tubal factor in our young women. That's one difference. Yeah. There are other unique exposures in the military that are important as well. One obvious one is, with deployments to places where there's war, there's always an opportunity to get injured. Mm-hmm. So post 9/11, we did see a lot more genitourinary, wounds are wounded warriors from IED explosions. And so that's really important. And so that's one. A third thing to think about is just exposures. Just depends on what job you're going to have in the military. Sometimes we're exposed to more jet fuels or different vaccines and organic solvents that they might be using for some of the military equipment. Burn pits happened years ago in Afghanistan and Iraq, and those toxins probably affect fertility. Another thing that's not talked about as much is PTSD. Right. The rates of PTSD and even sexual trauma in the military are very high. And so that definitely affects relationships, can affect intimacy, erectile dysfunction, all of those things. And then the last thing I would think about is that your career trajectory or your goals. Mm-hmm. Some of our young active duty women want to promote and they want to get as high as they can in their chain of command. And so sometimes, just like when going to med school or law school or business school, there are different goals and hurdles. And so people might put off having a family until later.
Right. So what can a woman do, let's say, to get ahead of some of the factors that you brought up? I mean, obviously a lot of that is not in our control, but what are some of the things that you would suggest?
There are a lot of things that I think that we can do. And one thing is that when our active duty women or veterans are coming in for their care each year to see their OBGYN, we need to be having the discussions about what's your family building plan. Maybe you're only in your 20s, you're not thinking about that, but we still need to talk about that. Maybe check your AMH level, see how your ovarian reserve is. Just get more information so you can make better informed decisions. Other things could be making sure that we're having a good lifestyle in terms of diet, eating healthful diet, vitamins with folic acid, other supplements, perhaps like coenzyme Q10, exercise, decreasing stress, and then finally, thinking about freezing your eggs or sperm as a part of fertility preservation, especially before deployments. It's just something to at least think about that we need to do a better job discussing with our active duty airmen and soldiers.
And that's a very expensive proposition as well. How can someone in the military find affordable treatment if they choose that that's something that they want to do?
Yeah, that's tough. And there are only a handful of Air Force, Army, Navy bases and naval bases that provide any type of fertility care. And they're only able to do that because they're part of a training program for their OBGYN residents. So it's expensive, but I think that at least talking to your OBGYN, getting a referral to an REI, whether it's on base or a local civilian, and ask the clinic, do you provide a military discount? A lot of them do, and they may not be on the Resolve website. I know our clinic's not even on the Resolve website, and we provide military discounts. So it's always good to ask about that, and sometimes getting discounts on medications because it is expensive. Doing IVF on a military installation can be a little bit more affordable, but it's hard to get into those places, especially if you're not stationed at that base. So asking lots of questions is probably the best way to see how you can afford it.
And let's say you're not stationed at that base where they provide IVF care. Can you kind of talk me through that process? Like, how would that look for somebody?
That's hard. So what I would recommend is that talk to your OBGYN, get a referral to an REI, and see if there is an opportunity to travel to a base, one of the bases that's closest to you, or get on their wait list for IVF. There are some restrictions or limitations in the military because we have only finite resources. So there are wait lists, unfortunately, and different cutoffs for age and body mass index that are important to think about. But sometimes you can travel to those bases, and if you can do a remote or telemedicine initial visit and then do labs locally, you can potentially travel to one of the bases and stay there for a few weeks for your stimulation. Mm-hmm. But one thing I will say is that sometimes the travel and the time you need to take away from work, getting permission from a commander, sometimes those obstacles end up being more expensive or more stressful than just staying local with a civilian clinic.
Right. And then if you're staying local with a civilian clinic, it's not necessarily under it's not like a military doctor is guiding your care. It's just like coming to see me or UNIT.
Yes. Yeah, and sometimes different, depending on the treatment that's pursued. Sometimes TRICARE, the military insurance, will cover certain medications, but they usually don't cover procedures like insemination or IVF.
And for those who are listening and watching us who don't necessarily know what an insemination is, can you kind of just take us through what's an insemination?
Yeah, so for someone who is going to undergo insemination, typically we will want to give some medications first, oral medications to help time ovulation better. We want that egg to come out at the perfect time. Insemination will involve either donor sperm or partner sperm, is washed in the lab, and then we take a tiny little catheter that's put through the cervix. You can place a speculum in the vagina and then put a little catheter through the cervix and basically push the sperm into the uterus. And the sperm typically are moving better. Hopefully they're the healthier sperm. And we are putting the sperm in the uterus at the perfect time, hopefully exposing that egg to millions more healthy sperm than in trying naturally.
Do you think if you're in the military, you would have that time off to be able to accomplish or like get to those appointments? Is that something that people are allowed to do?
I feel like, it of course depends on what specialty or what the job is of our soldier or airman, but commanders are very family friendly and will typically give time off for those appointments. So I never had an issue when I was active duty getting my patients in on time, even our active duty doctors who are very busy. So that can be something that's helpful. The only trick would be if someone has to travel more than an hour or so to get to the nearest fertility clinic. Sometimes that can get tricky, but commanders are typically very open to that.
So do you recommend someone, if you're going through a fertility treatment, to let your commander know? I mean, normally, like if I had a patient that came to me and she said, I'm planning on going through treatment, should I tell my boss? Is it something that you should tell your boss if you're in the military?
It's tricky. I feel like it's very private and you shouldn't have to tell your boss, but if you know that you are scheduled to deploy like next month to Afghanistan or something, it's hard to do these types of treatments without notifying somebody, because if you get sick or if you have a complication, that has implications for replacements and just their mission. So it's tricky. It's something that's very different than now in private practice. It's less important, or, I think it's more private. In the military, it's just really tricky depending on what your mission is. I feel like it should be private if we can keep it private.
Yeah. No, great advice. And so how can someone in the military maximize their chances of getting pregnant naturally?
Well, the things I tell all of my patients, mentioned a little bit earlier, healthful diet, that's one of the biggest things to at least start with. Sometimes when we're young, we can eat whatever we want and, it doesn't harm us. But in the end, we need to really be thinking about cutting out processed foods and trans fats and all those bad high glycemic index carbs. I tell my patients, make sure that you're exercising. You want to try to get into that healthy fertility zone BMI. Make sure that you're taking a prenatal vitamin with folic acid and iron. Consider something like coenzyme Q10 and fish oil. Those are a few things, just maintenance things that I always talk about. And then the other most important thing that we don't do a good enough job of probably is talking to the doctor, or the doctor talking to you, your OBGYN or your primary care doctor each year when you come in for your just annual exam. We should be talking about your reproductive goals. It's not about only about putting you on birth control pills and putting that off. We really need to be talking about your goals and maybe checking levels, see what your ovarian reserve is before you get on a birth control pill or anytime, because we want to make sure you don't miss your window of opportunity to have the family that you desire. So asking questions and really, trying to stay healthy in the meantime is important.
That's great. That's great to hear that with what being a military doctor, that those kinds of conversations are had.
Yeah, and I think we're getting better and better. I know that a lot of providers in the past were afraid to just check a random AMH, but now we're more open to it. And I think that we should, especially for our young women who, are going to deploy, or maybe you're approaching 32 and you haven't had your family yet. I mean, at least talk about egg freezing and fertility preservation, because we don't want to have that conversation 5 years down the road when you wish you had done something earlier.
So you mentioned an acronym for a hormone, AMH. For people listening who don't know what that is, can you tell us a little bit about what that is?
Yes, so AMH stands for anti-Müllerian hormone, and this is it's a test that we can do that gives us an estimate of how many eggs you have left. It's normal for that number to go down with age, so that when we are in menopause, we basically have an AMH of 0. It's an important predictive tool, though, at least in helping us predict how many eggs we might get from an IVF cycle or things like that. It's not a predictor of fertility per se, but knowing your numbers is empowering, because if for some reason you're younger and you have very low AMH, this might be the time to think about fertility preservation so that we don't miss an opportunity later, because we can't predict the rate of decline of our ovarian reserve. We're only born with so many eggs and they go away throughout life. So AMH can be helpful in counseling people.
Yeah, great. Thank you so much for that. So what advice do you have for a family who is serving, who needs fertility care? What can they do to be proactive? I know you've talked a little bit about it, but tell us more.
So I think don't be afraid to ask for a referral. I think that's the biggest thing I saw. Even when I was an active duty reproductive endocrinologist, people didn't even know I was on the base and would just struggle silently or be told, oh, you're young, just wait. So be proactive. Ask for that referral. If there's not a reproductive endocrinologist on the base, ask to be sent off base. Get a referral off base. You're allowed to do that, and that is covered by TRICARE. So that's probably the most proactive thing to do. And I guess the other things that I keep harping on is just really talking to your doctor every time you go to see them for just primary care. And, we have to go in every year for all these required tests in the military. So really talk to your doctor, not just about birth control every year, but talk about long-term goals and things like that. Or if they're not answering your questions or can't, ask for that referral, get empowered to get that information that you deserve to have now.
Right. And ask for clinics if they're not on the list for giving discounts to military. Just ask them for one, because most clinics do that.
Yeah. I find that to be absolutely true, and they can make it really affordable for you.
Awesome. Well, thank you for being on our show. I really appreciate all the advice you've given us about fertility care for military families. But I also love watching you on Instagram and following you. So you fill your Instagram pages with all these inspiring cooking shows, it seems. So tell us about that. How did you get into that? All your meal planning. It looks very fancy.
I know. That is a new thing. I used to hate to cook, and I used to just eat ramen noodles when I was in medical school, or even worse, like McDonald's. I can't believe I'm admitting that on this. But I recently just started reading more about eating more vegetables and just trying to be healthier, because I don't know, I just felt gross, and I've got joint pains. I'm getting older, blood pressure issues. And so I thought maybe if I look into eating a little bit more healthy, just eating a little bit less processed food, less red meat, less meat in general. So I just started reading all these books, and the recipes look good and it's fun.
Yeah. So for people who want to follow you, where do they follow you on Instagram?
I'm at Dr. Kate OLeary. And I'm new, so I'm a newbie. I didn't even have an Instagram until October of this year, which is crazy. It's embarrassing to admit that, but yeah, that's where you can find me.
Awesome. And tell us more about your clinic for people who joined the show after we started talking.
Yeah, so I'm at Institute for Reproductive Health, or IRH, that's in Cincinnati, and I started there in 2018. I've got 3 wonderful partners, and we've got 3 satellite clinics in Louisville, Kentucky, Florence, Kentucky, and West Chester, Ohio. We've got lots of patients that travel from many hours away, so we wanted to share that burden, and that's why we have all these satellites that we all drive to help decrease some stress related to that.
Awesome. Well, thank you for all you've done for our country. Thank you for what you do for your community and for everyone who's following you. You have to follow her, because when you follow her, all of a sudden you will get inspired to meal plan and do what she's doing. So thank you for all your hard work, and we appreciate you very much.
Yeah, thank you so much for the opportunity.
Of course. Thank you everyone for watching. Hope you'll join us for our next show, and see you guys soon. Take care.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.